Updated COVID booster is now available for elementary school age children, and there's a new Ebola outbreak to be aware of. I want to bring in Dr. David Winter from Baylor Scott White Health. Good morning, Dr. Winter. It is good to see you. First of all, let's talk about this new Ebola outbreak. This is in Africa, but why are researchers here keeping an eye on this?
Well, the last Ebola outbreak was 8 years ago, but this is a very bad disease, highly lethal. In previous epidemics, the death rate has been anywhere from 50 to 90%, wiping out entire villages. So no cases now in America at all. 19 deaths right now in Uganda, country in Africa. Watching it carefully to see who goes and comes from Africa. No cases here yet. We're going to keep a close eye on it because it's a very bad disease.
Dr. Winter, a new survey out of Scotland shows 40% of people who contracted COVID still experience long COVID symptoms many months later. So what does this signal?
Yeah, it's kind of scary. They talk about up to 40% of folks still have symptoms several months out. They're talking about fatigue, shortness of breath, trouble concentrating, some confusion. We're not sure why it's so high there. It seems to be lower here in this country. They did find that in Scotland in this study that if you'd had a vaccine, you were less likely to have long COVID, or if you did get it, you had milder symptoms. So something to think about with these vaccines.
And that updated bivalent COVID booster now available for children as young as 5. Let's talk about the timing of getting these shots. So I've read and heard 2 months after a COVID infection, 3 months after that primary vaccine series, the mRNA primary vaccine series. Is this the same across the board for all ages?
It is indeed, yeah. If you've had COVID or had a COVID vaccine, you have to wait at least 2 months. 3 or 4 is probably okay also, but at least 2 months, otherwise you'll likely have a reaction to that. But it does seem to work very well. The bivalent vaccine is a newly formulated vaccine against the BA4, BA5, the current variants that are around there, plus the other variants. So it's a wide spectrum vaccine that works very well. Everybody, we're encouraged to get that now. We'll probably next year say get another one because we're going to reformulate this, I think, every year, just like the flu vaccine.
Dr. Winter, I'm hearing about a BQ variant, and now the CDC hasn't officially announced this yet, but I'm wondering whether it's a BQ variant or something else. Should this bivalent vaccine that we have available to us protect or offer some protection against any new variant that could emerge here?
Yeah, there's 3 or 4 new variants out there in small places around the world right now. They're not really taking over yet. Will they? We don't know. Will they be susceptible to the vaccine? We don't know that. But the BA4, BA5 had some actually, it worked, the old vaccine worked for those right now. So yeah, we're hopeful it's going to work well, but we don't know the answer to those questions right now, Sonia.
Okay. And finally, Dr. Winter, this week the New England Journal of Medicine published a study suggesting that colonoscopy is not as effective at preventing colon cancer as previously reported. Now, look, I talked about this on Daybreak earlier this week. There's nuance that we should clarify as it relates to this study, but go ahead. What is your view on this?
Well, first, it's important to point out the landmark study was in 2018 said that if you get regular colon screening, your chance of dying of colon cancer is 67% less. Now, when you look at the data from Europe that did this study, if you take just the people who got colonoscopy, the numbers are about the same. So their data looked at everybody who was encouraged to get one but didn't get one. Bottom line is colon cancer screening does work. Colonoscopy works. Stool studies also can help with that. But if you get colon cancer early, it's curable. Late-stage colon cancer is deadly.
Yeah, I think it's all about how the research is presented. Dr. David Winter, good to see you. Thank you so much for your insight today.
Thank you. Thank you. Bye-bye.